everybody. Hope you all are fine and enjoying good state of health. Today's topic for discussion is pectoral region, which is divided into two parts. At the end of the session for first part, the participant should be able to define pectoral region and list the components of pectoral region, describe skin, especially nipple and areola, skin's innervation and blood supply of the area, superficial and deep fascia of the region, especially clavipectoral fascia, and at the end correlate some of the clinical applications. At the end of this session for second part, the participant should be able to describe muscles of the pectoral region along with their innervation and emphasis on their action. These muscles are pectoralis major, pectoralis minor, serratus anterior, and subclavius. And at the end, should be able to correlate some of the clinical applications. Pectoral region is the anterior upper part of the chest on either side of the sternum. Consists of structures which connect front of the chest with arm and shoulder and provide movements to the upper limbs and the ribs. In female, the breast is present, which is the most prominent structure in females. The components of the pectoral region are number one, skin, which is thin and hairy in males, whereas in females, this is thin and non-hairy. There are two speciality, that is nipple and areola in the female. Nipple is a raised region of tissue on the surface of the breast. It contains the outlet of 15 to 20 lactiferous ducts, whereas the areola is a circular, darker colored area of the skin surrounding the nipple. It has got sebaceous glands which are named as Montgomery's gland. These glands secrete a lubricating oil which prevent crackling of the nipple. Then is the superficial fascia, which contains the breast. Deep fascia is present in two laminae. The deeper one is named as clavipectoral fascia. Then is the thoracoappendicular muscle component of the pectoral region. These are pectoral muscles, which are also referred as pecs, that is pectoralis major, pectoralis minor, subclavius, and serratus anterior. Skin of the pectoral region is innervated by supraclavicular nerves, that is medial, intermediate, and lateral. From the cervical plexus, they supply the upper part of the region. Second group is anterior cutaneous nerves, which are terminal branches of thoracic second to sixth. They supply medial part of the region. Third group is intercostobrachial nerve, which is the lateral branch of thoracic second nerve. This nerve supplies a small upper and outer region of the chest, which lies close to the axilla. Then is the lateral cutaneous nerves, which are lateral cutaneous branches of thoracic third to thoracic sixth intercostal nerves. They supply the lateral part of the region. Blood supply of the region. First, the arterial supply, which is by very small vessels. Number one, perforating branches from the internal thoracic artery which supply the medial part of the region. In intercostal space second, third, and fourth, these perforating branches are large, especially for the supply of the breast in females. Second group is lateral cutaneous branches from the posterior intercostal arteries which supply the lateral part of the region. Third group comprises lateral mammary branches of the lateral thoracic artery which supply the lateral part of the region. This is especially larger in females. Fourth group is pectoral and clavicular branches of thoracoacromial artery which supply the upper and lateral part of the region. Venous drainage is through veins which follow the arteries. Superficial fascia in this region is present as an irregular layer of loose connective tissue, and it contains moderate amount of fat which is absent under the areola. Next constituent is mammary gland or the breast in females. It is present between the two lamellae of the superficial fascia, which forms an ill-defined capsule. Numerous fibrous septa pass from skin to the deeper parts among the lobules of the breast. These, these fibrous septa are named as suspensory ligament of Cooper, and these ligaments are responsible for the maintenance of integrity of the breast. Superficial fascia also contains a muscle in the lower, that is lower part of the platysma, which is a thin broad sheet which arises from fascia covering pectoralis major, and fibers run upward and medially in the neck and are inserted into the base of the mandible and skin overlying the posterior and lower part of the face. It also contains the cutaneous nerves and vessels. Superficial fascia allows free movement of the skin over the underlying structures. Deep fascia of the pectoral region is present as a thin fibrous membrane which is devoid of fats. It extends superiorly up to the clavicle where it becomes continuous with the fascia of the neck. Medially, it reaches the sternum and becomes continuous with the opposite side's fascia. Supralaterally, it becomes continuous with the deltoid fascia, whereas infralaterally, it becomes continuous as the axillary fascia, whereas inferiorly, it continues as the thoracic fascia. Deep fascia covers and binds all structures of the region. It is present as two layers or lamellae. Superficial covers the pectoralis major, whereas deeper layer covers pectoralis minor and extends up above as clavipectoral fascia and below the pectoralis minor as the suspensory ligament of axilla. Clavipectoral fascia is deep lamella of the deep pectoral fascia which lies between clavicle and pectoralis minor. At its upper extent, it splits to enclose subclavius. Its anterior lamellae is attached to the clavicle, whereas the posterior lamellae or lamina continues above with the investing layer of deep cervical fascia above the clavicle, and below the clavicle it merges with the axillary sheath which is present behind this fascia. Along the upper border, below the subclavius, the thick upper part of the clavipectoral fascia which lies along the lower border of the pectoralis minor and extends from first rib near costochondral junction to coracoid process is named as costocoracoid ligament. At its lower extent, it splits to cover the pectoralis minor. Down below, it continues as the suspensory ligament of axilla, which is attached to the axillary fascia and maintains the concavity of the floor of the axilla. The clavipectoral fascia at its medial extent blends with the periosteum of upper two ribs, costoclavicular ligament, and fascia covering the external intercostal muscles of the upper two intercostal spaces. At its lateral extent, it is attached to the coracoid process and blends with the coracoclavicular ligament. In this diagram, notable points are the relative position of clavipectoral fascia, pectoralis minor, and the suspensory ligament of axilla. As regards the clinical anatomy, collection of pus between pectoralis major and minor is a rare sight, but collection of pus behind pectoralis minor or in the neck is quite a frequent phenomenon. In such cases, pus can travel either way through cervico-axillary canal, which is considered to be gate of entry or exit for the pus. Clavipectoral fascia is pierced by lateral pectoral nerve, thoracoacromial artery, lymphatic from breast to the axillary lymph nodes, and cephalic vein which drains into the axillary vein. Notable point is that first two structures of the above pass outward, whereas the last two structures of the above pass inward. To be continued as second part of the pectoral region.